I'm Paige, and my disease was elephantiasis. What is elephantiasis? It's the hardening of the tissue in the arms and the legs, your limbs, and other parts of your body like male genitalia and female breasts. It is also known as lymphatic filariasis. Lymphatic filariasis is a vector-borne disease found in many tropical countries. It is caused by nematode worms, which are roundworms that are passed through mosquitoes to humans. There are 3 types of species that cause LF, which is lymphatic filariasis: Wuchereria bancrofti, Brugia malayi, and Brugia timori. So I'm going to start with the first one is Wuchereria bancrofti. It's the most common infection worldwide. It is a filarial nematode. It does not affect the intestinal tract of the vertebrate host, but it does infect the lymphatic system, and this causes filariasis. It affects about 120 million people around the tropical area, Africa, Southeast Asia, Indonesia, South America, etc. The female worms range from 80 to 100 millimeters in length, and the males range from, they're just 40 millimeters in length. Only the female mosquitoes that are under the category of genera Culex, Aedes, and Anopheles can transmit the worms to human in this type of species. And the microfilaria are nocturnal, so they sleep at night. They don't sleep at night. And then here's the diagram showing like how it goes from the human and how it infects. Keeps going. The second and third one are Brugia malayi and Brugia timori. Very common. First one is Brugia malayi, very common to Wuchereria, but smaller and has different infected mosquitoes. The types are Mansonia and Aedes. The female worms range from 43 to 55 millimeters in length, and the males range from 13 to 23 in length. The microfilariae also have nocturnal periodicity, just like the Wuchereria, so that means they sleep during the day and act during the nighttime. This specific nematode is geographically limited and occurs only in Southeast Asia. Brugia timori is not as common, only found in lesser Sundan islands of Indonesia, and this microfilaria is transmitted by only Anopheles barbarostis. And here's another picture. It's a little smaller. It just shows how this one is affected. It's pretty much the same way, just less common. And how does someone get infected? When a mosquito is biting someone, is feeding on a human, they can ingest the larvae, which is the larvae is the microfilaria, which is just a microscopic worm. And they are microscopic worms that are just around, so it could go into the mosquito can ingest the microfilariae, and once it's inside the mosquito, it will make its way to the salivary gland, and so the next time a mosquito feeds, the parasite will be injected. And then once it's injected, it will circulate around the circulatory system to get into deeper tissues. When they find their place, they begin to mature. And so for about 5 to 7 years, the adult worms live and reproduce more microfilae. And they're in the lymphatic vessels, so they just keep growing. So even if they die out, there's still going to be more. The microfilae do not come out during the day. They find a place in the capillary of the internal organs to stay put, and then at nighttime, like they're nocturnal and come out and swim freely around the bloodstream and feed. If a mosquito who is not infected bites someone who's infected, the mosquito is now infected, so the next person they bite will be infected. The signs and symptoms, usually it is acquired in childhood but doesn't start to show the painful and disfiguring manifestations until later on in life. The filariasis is asymptomatic, which means no symptoms for years, but one day the tissues will start to harden. Even though there are no symptoms, the infection is still destroying the lymphatic system, the kidneys, and changing the immune system due to the damage of the bacterial. acute episodes pop up and cause temporary disabilities. With the body deformities that come along with the disease, it can lead to social economic burdens such as isolation and poverty. Acute and chronic conditions appear in inflammation of skin, lymph nodes, and lymphatic vessels. Symptoms continued. The acute conditions coincide with the chronic portion, which are lymphedema and elephantiasis, which is what I'm talking about. Majority of the acute episodes are due to lymphatic damage. Lymphedema is the swelling of tissues, and when progresses into elephantitis, so once this starts to get worse, it becomes irreversible. It has a grade scale of 1 to 4, so 1 being it can be reversible, 4 being it's elephantiasis, so no, not reversible. Treatments and preventions recommended by the MDA, which is the Mass Drug Administration, is taking together a single dose of albendazole of 400 milligrams and ivermectin of 150 to 200 mcg/kilograms. They can clear the microfilariae from the bloodstream. Another treatment plan is taking diethylcarbamazine, which is very effective in killing microfilariae and adult worms. Some prevention to control the mosquitoes are staying indoors when mosquitoes are active, putting bug spray on, using mosquito nets, and wearing loose, long, light colored clothing so it doesn't affect them. To the patients who are already diagnosed, it is advised to maintain good hygiene and take precaution to prevent secondary infections, which are other things caused from your elephantiasis. It can have ulcers, like scratches, other bacteria can get inside there, so keep it clean. In severe cases, medical therapy is used and surgery can be an option, but it's the last option. If male genitals are affected, then reconstructive surgery of the penis and scrotum is successful and very recommended for people. To treat secondary infection, use anti-streptococcal antibiotics to relieve the infection. Also, going back to this one, another one is if you are getting blood work done, they're only going to do blood work at nighttime because that's how you're going to test if you are, if you do have the parasites in your body. So that's another thing. If they do blood work and they find out, that's how they do it, it's at night. And then areas affected are people who live in the tropical or subtropical regions have a greater risk of getting infected. Short-term tourists or people who stay there for a little bit they're very low at getting it. Currently, no one in the United States is affected, but there was one case in South Carolina a few years ago, but it's gone. 72 to 73 countries are at risk because more than 1.4 billion people are affected. 65% of people who are infected live in Southeast Asia regions, 30% in Africa regions, and last 5% in other tropical regions.